Good morning and welcome to this first JIB webinar of the year, Unlocking the Power of Your JIB Benefit Scheme. My name's Roger Horne and I'm Head of Membership at the JIB. Joining me this morning is Sam McGaw, who's the Account Director from Bupa, and Rob Lowe, Business Development Executive at ECIS. Can I just thank everyone for obviously interrupting your sort of busy schedules and joining us today. And just a little bit of sort of context, initially. The JIB benefit scheme is a uniquely packaged scheme that looks after the health and well-being of employees covered under the JIB agreement. I think the majority of people who've registered, not all, but majority are from JIB member companies. And the scheme really is a cornerstone of the JIB agreement from a health and well-being perspective, and offers a really comprehensive package of support. But it's the thing, particularly the private medical element, but the whole sort of JIB benefit scheme is something that I get probably the most questions about when I'm sort of talking to members. So we did a session like this sort of year before last, and we've decided to put on another session today with the experts from Bupa and ECIS to talk through the PMI, the sick pay, private medical insurance, sick pay and other insurance cover. And if time permits, answer any questions. What we're looking to cover today is a short introduction from me. I'll hand over to sort of Sam shortly, who will talk through the private medical cover, and then we'll go to Rob, who will talk through the rest of the other elements of the benefit scheme. Just to say, the webinar is being recorded, and it will be placed on the JIB sort of YouTube channel. And the slides will be made available after the session. I'll be sending out sort of a short feedback survey sort of as well. There's a Q&A and chat facility, so feel free to ask any questions. But if we don't get to your question today, we'll come back to you offline after the event. So without further ado, I'll stop sharing my screen and hand across to Sam.
Thank you, Roger. Morning, everyone. So as Roger mentions there, my name's Sam McGaw. I'm one of the account directors here at Bupa. And I suppose my role today is essentially, as Roger mentions there, to take you through the private medical cover that you have with Bupa in terms of a few things we're going to go through really today. So let me know when you can see my screen. Does that come through?
I've got that, Sam. Thank you.
Yeah, great. So there's a few things we're going to chat through today. So the first thing we're going to go through is the features of the scheme. So essentially, what are the features of the scheme, whether you're new to the scheme, whether you've been on a while, whether you've used it before, whether you've never used it before, in terms of how it works and how the products and the propositions created. The next thing we're going to go through is how you can actually use the policy. So how do you make a claim? So the various avenues of making a claim and actually using the private medical cover. And then the final sort of the presentation before we go into any questions that want to be asked is around sort of how it's also here to help you with everyday needs. So not just when you're actually ill or you need surgery or you've got an illness that needs attention, how the actual proposition's been created to help you with everyday needs, not just actually when you actually need to claim and that sort of thing. So I suppose the first thing from me to take you through are the features of the scheme. So the first thing to mention is what we call the underwriting of the policy. So how this works for members at JIB. So the medical history disregard is, as you'll see on the screen there. So what this means is when you join the policy, so at the point of you joining, we don't ask or take into account any of your previous medical history. So what that essentially means is you're covered for any condition as long as it's eligible under the rules of the scheme. So how this might differ from, let's say, if you went to take out a Bupa policy on your own as an individual sort of consumer policy outside of the corporate scheme that you've got with us, you would be asked to be underwritten. So that means we would ask you for X amount of years of previous medical history. And then depending on what you write back to us, we would then look to apply that as an underwriting. So essentially exclude you from being able to claim for that. So I suppose one of the main benefits of this policy, so this corporate policy that you've got, is that we actually don't look or consider any of that at the point of joining. So if you're new to the scheme, if you've been on a while but maybe never used it before, that's just something to bear in mind, that if you've had something that's previous or pre-existing before you've actually started your cover, then we don't take that into account. We just assess eligibility in line with the actual policy rules, which our advisors, when you ring through, will be able to help you with and how to do that. The next thing to mention, so the excess of the policy. So essentially, this is the amount of money that you have to contribute towards eligible treatment costs. And then once you've paid that amount, Bupa will cover up the rest up to your benefit allowances. So you have what we call a rolling excess of £150 per 12 months rolling period. So how this works in practice, so you'll only need to pay the excess once, so the full £150 once per rolling 12-month period. So no matter how many times you claim, this process applies to everyone that's covered under the scheme and applies in the same way. So in practice, what this means is the scheme renews on the 1st of January each year. And what a rolling excess is designed to do is look back 12 months from when you claim to when you've claimed previously. And then if it sees the system that you haven't claimed previously, it will apply the excess. But if it sees that you have claimed and paid your excess within the previous 12 months, it knows not to charge you an excess because you're within that 12-month period. So that that goes past renewal dates. So the standard excess that we apply, which doesn't apply to yourselves, would refresh regardless every renewal date. So the 1st of January in your case. However, the rolling excess doesn't take into consideration renewal dates. So if you've started treatment, let's say in November, December last year, you've paid your excess at that point, and your treatment continues into the new year, so January, February, March onwards, the system knows to look back 12 months. So it wouldn't apply an excess until you've hit that 12-month period. And then on the right-hand side, you've got a bit of an example of how it works in practice there as well. And as Roger mentioned at the start, this is being recorded, so you can always come back and review this. The next thing to mention is probably one of the cornerstones of our proposition, and that is in regards to what we do and how we treat and help you with mental health issues. So we call it the mental health advantage. So whether you're struggling with anxiety, things like drug, alcohol abuse, stress, depression, or any other mental health condition, we've made it simpler over the last few years for you to access the right support. So there's a couple of things we do here. The first thing we do is apply what we call extended cover. So we now cover most mental health conditions. So the exclusions would be things such as dementia, Alzheimer's, those sorts of things. But things such as we've mentioned at the start, anxiety, depression, stress-related, alcohol, drug abuse, those sorts of things would be, we would look to cover those under your policy. How it works is, depending on what type of treatment it is you're looking for, we apply, if it's an outpatient treatment, so let's say if you need to see a counsellor or a psychologist as an example in an outpatient setting, that would apply up to your outpatient limit, which is £1,750 per person per year. So any treatment that you have that is in an outpatient setting under the mental health benefit erodes that £1,750. And then separately to that, if what you're needing treatment for is on more the severe scale, so where it might need day patient or inpatient treatment, the scheme has 45 days covered in full for any day patient or inpatient mental health treatment you need. The reason we do it as a day amount rather than a pound value for a day patient and inpatient is it's very costly, very expensive treatment depending on what you're having as an inpatient or a day patient. So we think it's much clearer, much easier for people in that scenario to know how many days they've got covered in full rather than setting a monetary limit to that. So it's designed to make it easier for the person that's going through treatment at that point. And also the mental health benefit is designed to actually support the physical as well as the mental side of the mental health side of things. So essentially, we cover mental health treatment that relates to physical conditions. So for example, if you're going through surgery for an MSK condition, so muscles, bones and joints issue, or let's say someone's being treated for cancer and the mental side is taking an impact, we would also look to cover the mental side of things, not just the physical side of things. So it's more of a holistic, full wraparound support to help that individual that's going through treatment, not just with the physical side of things, but also help with any mental health issues or needs that they have as well. The next thing to mention, so the muscles, bones and joints size of the proposition. So we know at Bupa, if left untreated, a bad back or a knee injury can turn into something quite serious very quickly. So what we've designed is essentially pathways to help you tackle things as early as possible. So we have at Bupa a dedicated musculoskeletal team, or MSK support team, who are a team of specialist advisors who can give you practical advice how to aid your recovery. So whether you're pre-treatment, post-treatment, post-surgery, whatever it might be, you've got access to this team to help get that advice, how to aid your recovery, might help manage your condition, and also help you make informed decisions. I'll give you a second ear to listen to once you're being treated by a therapist or a consultant based on what it is you need. And then we also offer treatment that suits the individual. So our clinicians can discuss a range of clinically proven and eligible treatment options with you. And that can range right the way through from physiotherapy to surgery and everything in between based on what it is. So scans, x-rays, anything that you might need based on the MSK injury that you've got. And again, similar to mental health, how that works is for anything that takes place as an outpatient, so any physiotherapy, for example, any consultations that are in an outpatient setting, they would erode your £1,750 outpatient benefit. Anything that is being treated as a day case or as an inpatient, so if it's inpatient surgery, for example, would be covered in full as part of the policy, subject to excess, which we mentioned at the start of the call. And then the way our sort of network's been developed is to provide you a range of options right the way through from, as we've mentioned there, podiatrists, physiotherapists, osteopaths, right the way through to orthopedic surgeons and neurosurgeons, depending on severity of what it is you're presenting with. And then you have a separate £250 complimentary medicine benefit, which is there to provide £250 towards osteopathic treatment, chiropractic treatment, or any acupuncture that you might need. So that's a separate £250 for those three areas, and our advisors will be able to help navigate and give you choices of who you can see if it's deemed that that is the most appropriate route for you. And then the next thing to mention is what we call our Bupa Cancer Promise. So this essentially means that if you are diagnosed with cancer, or anyone that's on cover is diagnosed under the JIB scheme with cancer, we'll look after that individual for as long as they have Bupa cancer cover included. So what this means is there are no financial or time limits. So this means that you won't run out of funding for treatment midway through. The outpatient limit of £1,750 doesn't apply when it comes to cancer, so we will cover any outpatient cancer treatment in full, so long as you've still got the Bupa cancer cover, as it mentions at the top there. One of the main benefits of having private or going through private cancer treatment is, depending on what type of cancer someone's being treated for, you can get access to breakthrough drugs and treatment, so things potentially that aren't even available on the NHS yet. So these are sort of the real differences if you're thinking of having treatment NHS versus private. From a cancer perspective, access to these drugs and treatment are one of the things to consider, and our advisors will be able to help you with that if you are ever going through this. And we also offer, where it's clinically appropriate, treatment where the individual would need it. So you'll have access to a network of cancer specialist centres, hospitals, and consultants. However, if your consultant approves, you also have the option of having things such as chemotherapy delivered in the comfort of your own home. So it's just there designed really to give the individual that's going through this the choice and the options, so long as it's clinically appropriate to have treatment at home where possible for this. And just a bit more on the cancer support. We have, similar to MSK and the mental health, we have a specialist oncology support team. So very similar setup. The team are there to surprise, offer clarity, advice, and vital support for difficult decisions for you and the family. Also, you have, as we mentioned earlier, access to qualified counsellors. So not just there treating the physical side of the cancer treatment, but also helping with the mental impact and the toll that can happen from that as well. So you'll have access to our trained counsellors that can provide with the emotional and psychological support. You'll also get access to the Live Well with Cancer program. So this will help you make that transition really from active treatment to living through and beyond cancer. So essentially, this could be anything really from lifestyle advice to signposting you to support groups and those sorts of things to help you make that transition from the active treatment through to the living through and beyond throughout remission. And then at Bupa, we know that if a parent or a grandparent is diagnosed with cancer, Having those conversations with children can be particularly challenging, like how do we phrase and word what we're trying to say. So we have created 4 illustrated booklets which can help with those conversations. So these are aimed at children aged 7 to 11. They've designed clear to essentially describe what the person's going through clearly and sensitively and help you have those conversations with children. And then for sort of complex cases, you also get ongoing, dedicated and personalized support. So essentially you'll get a case manager that will be there to help you through, hold your hand through the whole journey really from a Bupa perspective, and just be there to give you that extra support throughout the whole treatment journey. The next thing to mention in terms of what is covered as part of the features of the scheme are there are various cash benefits that apply to the JIB scheme. So these vary depending on what treatment you're having and where you're having it. So it basically applies that if you choose to have treatment at an NHS facility rather than a private facility, you get various cash benefits depending on what it is. So the first one to mention, you'll see in the bottom left-hand corner, is our standard or the typical NHS cash benefit, which is essentially where if you have NHS treatment or instead of using private, we'll pay you £200 cash benefit for every night you spend in hospital, up to 35 nights per person per scheme year. So how you go about accessing this is essentially once you've been discharged from the NHS facility, you'll get your discharge notes. You'll just need to submit them to us, and then we'll apply the £200 per night based on the number of nights that it says on your discharge notes. The next one to mention is what we call the NHS procedure specific cash benefit. So for some particularly complex surgeries or treatments that an individual's having, you may be able to claim a procedure specific cash benefit, which is based on the complexity of the treatment you're having. So if you decide to have very, let's say, complex spine surgery on the NHS or heart surgery rather than using private, we'll provide a benefit lump sum payment for the whole admission for that treatment, taking into consideration the actual surgery that you've had as well. So that is just one to bear in mind if that's something that you've been through or going through while you've been on cover, to speak to our advisors and they'll be able to advise more. And then the final one is if people choose to have their cancer treatment via the NHS, you are also eligible to our NHS cancer cash benefit. So this is paid when someone has inpatient treatment, so radiotherapy, chemotherapy, surgical operations, or outpatient, day patient, or home treatment as well. So for each day you might receive radiotherapy or chemotherapy in a hospital or home setting, you would be eligible for this NHS cancer cash benefit as well. So very similar to the first one, you just supply us with the discharge notes and the details of what you've had via the NHS, and we would apply the cash benefit in line with the number of days that you've had treatment for cancer via the NHS. And then what people tend to use these for, so they're designed really to help with everyday costs such as travel expenses, hospital car park costs, which we know can get very expensive the longer someone's in there, and things such as unexpected childcare costs and expenses as well. The next thing to take you through is some of the pathways that we've designed to basically get the person or an individual that's got an issue treatment or spoken to or an appointment as quickly as possible. So the first thing to mention that we've developed over the last few years is what we call the remote skin assessment. So this is there for people that have a worry about or concerns around any moles or skin lesions. This remote skin assessment is there to help them get the signs checked for skin cancer from the comfort of their own home. And this service is available nationwide and can be used for up to 3 moles and skin lesions that a person is concerned about at a time. So all that you need to do, there's no need for a GP referral, but if you do have a mole or a skin lesion that you're concerned about, you just need to call the team on the number that you see there on screen. They'll discuss your symptoms, talk you through a bit of a triage call to assess those. If deemed eligible, they will offer this service for you, and then you'll just essentially, if it's something you want to go for, you'll receive a link to register for this service at home. The next thing that happens is we send to you a home assessment kit, which is essentially a smartphone with a dermoscopic lens that you attach to the smartphone. You follow the instructions on the screen, which is essentially you'll take pictures of the moles and the skin lesions that you're concerned about. You'll send them off, and then they go to a dermatologist to review using the pictures that you've sent via the dermoscopic lens. And then 2 things can happen from here. they can either give you the all clear, so the peace of mind to know that there's nothing to concern about. They might be able to diagnose it as something that isn't anything to worry about. Or if it's something where there might be a bit of a cause concern, they can give you a referral to a dermatologist to see them in person, face to face. So that is essentially the options there in terms of what can happen from that. So this again is designed to give people access to treatment for something that they're concerned about, so a skin lesion or a mole, as quickly as possible, rather than the traditional route of waiting to see your NHS GP, waiting for a referral, which we know can take sometimes weeks and months in certain cases, depending on where you live. The next thing to mention, so quite similar sort of feel, but this is our rapid cardiac assessment. So we know that heart health worries can't wait. That's why you can speak to a cardiologist within 2 working days of calling using this service, and you can do everything and the call and the that you have with some of the tests you can do from the comfort of your own home. So the first thing you need to do if you've got any heart concerns, unexpected palpitations, anything like that, chest pains, you can call our cardiac team on the number that you see there for pre-authorization. Following this, you'll receive a virtual consultation with a cardiologist, which is appropriate to your symptoms within 2 working days. The cardiologist will have a conversation with you, and then if deemed necessary, they'll refer for diagnostic tests if required. And some of these are now available in your own home, so they can send certain things, heart monitors, etc., out to home. So you might not have to go into a hospital setting for some of these diagnostic tests. And then once the diagnostic tests and results are back, we will book a follow-up consultation with your cardiologist, who will advise if further tests are needed or treatment are required. And then if your symptoms are nothing to worry about, they'll discharge you with a medical report that can be sent to your own NHS GP, just to make sure that they're aware of everything that's taken place from there as well. So that is essentially, you'll have an initial consultation within 2 working days. So again, similar to the skin one that we just talked about, designed to get you treatment on or spoken to a specialist as quickly as possible when you've got an issue there. So the next part is how Bupa provides, or the policy provides, healthcare on your terms. So there's a couple of things to run you through here. The first one is how you can use the My Bupa portal. So this is essentially a web page or an app that you can download via the Apple App Store or the Google Play Store, depending on what phone you've got. And this is essentially the one-stop shop for anything Bupa related that you might need. So you can see your claims history, you can see numbers to call for the team, you can see all of your policy documents, you can see your pre-authorization numbers, you can even request treatment without the need to ring up. So various options for you, just all via the app or the web page. So you'll see there the link. You can either register via downloading the app or register there via the bupa.co.uk/mybupa/dashboard. You can register either with your work email address or your personal email address. As long as you register with the details that are mirrored on our Bupa system, our system will recognize you based on your name, date of birth, address, those sorts of things. And then once you've registered, it'll ask you through multiple factor authentication. So would you like to use your thumbprint, Face ID, set a passcode, those sorts of things. And then once you're registered, you'll find all of your scheme and benefits all in one place. So again, if you've not got this app, feel free to download this or go onto the webpage whenever you'd like. And all of the services, as we've mentioned, will be there for you in one place. Within the My Bupa app is the what we call the Bupa Bluer digital healthcare sort of platform. So this is where you can actually get access to GP, nurse, physio, mental health nurse appointments on the go, unlimited access as convenient to you. So you can see a GP or another healthcare expert, as we mentioned there. So it's open 7 days a week. It's open Monday to Friday, 8 till 10 p.m. and then at the weekend, 8 till 5 p.m. So everyone that is on cover on this policy gets access to this. It doesn't draw your excess like other treatments would do. So you wouldn't have an excess applied when you use this policy. And the GP that you speak to can do a range of things. They can provide a private prescription, which you would just pay the charge for yourself, or they can give you that referral that your NHS GP might do if they think you need to go into secondary care. So this is there to make sure that you've got access to a GP or a nurse or a healthcare professional, depending on the symptoms that you've got, as quickly as possible. So that is, again, there and free for everyone to be used as part of the policy. And then also within the My Bupa app, over the last sort of year or two, we've developed the sort of digital wellbeing support that, again, is completely free and accessible for everyone that's got the Bupa cover. So on here, that's broken down into two areas. We've got the fitness center, where you can do things such as yoga classes, high intensity workouts. You can set your own personalized exercise plans. So for example, if you're time poor at the moment, you've not got time to go to the gym or go for any exercise, run or walk or anything, you've got this as an option to do in the comfort of your own home using the My Bupa app on your phone. And then on the well-being side of things, this is more to help with the mental well-being side of things. So there's a guided meditation space, well-being articles and videos, completely free, completely there for everyone to use at their own disposal. And again, that is all accessible via the My Bupa app or webpage. The next thing to take you through is how to make a claim. So the various avenues of making a claim through the Bupa policy. So for those who've maybe never claimed before, fairly new to the policy, or might not have claimed for a few years and want to know what's changed, we're going to take you through how it works in practice. So I suppose the first thing to mention is if you have any symptoms or signs of cancer, or any symptoms or signs of a muscles, bones, or joints condition, you don't need to see a GP first. You can call us straight away and use what is known as the direct access pathway. So if you are ringing about any of these two condition areas, you'll just ring the number there that's on screen. You'll speak to one of our advisors who will do basically a triage call with you. So roughly book you in for a triage call with one of our specialists, depending on what it is. And then that specialist will take you through, talk through your symptoms, and then based on the end of the call and the outcomes of it, they've got a range of options. So they can give you anything from, if it's muscles, bones, and joints, they can give you some guided exercises at home to do. They can refer you into, depending on the severity, they can refer you to a physio, they can refer you to a surgeon. And likewise, similar sort of process for cancer. They can do things such as refer you to an oncologist if the signs and symptoms are there for deem referral necessary. The next thing, so if it's not cancer, if it's not muscles, bones, and joints issue, if it's anything else, you would go and see your GP. So whether that's your NHS GP, whether it's the My Bupa GP that we just spoke about, if they'd listen to your initial complaint, talk you through any symptoms, issues, conditions that you potentially got. And if they think secondary care is needed, they can give you what is known as an open referral. So the My Bupa GP, for example, would email you this if it's deemed necessary after your appointment. Once you have that, you just call us on the number that you see there on screen. And then essentially you speak to our advisors, explain that you've been to see your GP, what you've been to see your GP for, and then that advisor would just discuss eligibility, what's possible, and then give you, if it is eligible, give you the pre-authorization code, talk you through the benefits, and give you options of who you can see. So they tend to give, depending on what it is, they might give between 3 and 5 options based on where you live or where you work, to give you options of who you can see. So I suppose the very important thing to do before having any treatment is to make sure that you call us and talk to our advisors, just so you're crystal clear on exactly how it works, what's eligible, what's not, and how it works from there. So I think calling us at any point or any journey, even if you need advice, if you've not even got a referral yet and you just want to know how it works in a bit more detail, the advisors are there to help you. The next thing to mention, so when you have a referral, so as I mentioned briefly there, you get an open referral, which is essentially a referral into a type of specialist rather than a named specialist. You'd basically, what the policy applies is what we call the open referral. So this is where we help find the right consultant or therapist for you based on various things, such as where you live, where you work, ensuring that it's fee assured so that there aren't any surprise or shortfalls there. And then for consultants to be part of our open referral network, they have to meet certain criteria, such as the quality of the care they offer, number of patients they see, etc., so that we know we're referring you to someone who comes highly regarded from that perspective as well. So they're selected also, as we mentioned, on the value that they offer to you, the quality of care, and also the experience of the patient experience that they provide as well. So that is how it works. So as I mentioned previously, when you call it with your referral or to use the direct access pathway, depending on what it is you're looking to claim for, we will give you a choice of 3 to 5 consultants or therapists. Once you have that list and you're ready to then go and look to booking your treatment based on one of those options, you can use our Finder website, so finder.bupa.co.uk. This essentially houses all of our consultants, therapists, hospitals within our network. You can take that list that you've been provided with to go and do your own research to see who might be the best fit for you. And then once you've made your decision, on our Finder website, the details of how to contact that person and how to book in the appointments. So what consulting rooms do they work from? What hospital do they work from as well? Numbers to call, websites to book in, appointments for, all there for you on the Finder website, just designed to make the navigating the journey that bit easier for you. And then sort of the final bit of the presentation before we go into any questions, a few things to talk around how Bupa is designed to be here for you every day, not just when you're active or having an acute treatment and therapy or surgery, those sorts of things. So the first thing to mention, so outside of the private medical scheme, you also have access to the employee assistance program. So this is designed to give you 24 access to a team of experts to support with your mental well-being. So these essentially you'll get access to one of our counselors 24/7 on the number that you see there at the bottom. You can use this service for anything from relationship worries, if you're having difficulties at work, if you've got emotional issues, stress, anxiety, depression, those sorts of things. It can go also that bit wider to help with financial or legal worries as well. If anyone has anything like that, we can support. So the number to call to speak to one of our counsellors is there. And then how it's designed to work. So if the EAP can offer counselling to support the issue that you're presenting with, they will do. If it's that bit's too severe for the counselling sort of program, if it deems certain different type of talking therapy, because you've got private medical cover, the EAP counsellor can refer you to see a different type of therapist. And then our advisors, as you mentioned, you just need to speak to the PMI, the healthcare advisors, to say that your EAP counsellor's referred you, and we'd be able to give you options of onward care to be used within the private medical. So it's designed to link together from that perspective as well. You also have access to our nurse line, so 24/7 with Anytime Healthline, number there 0345 607 7777, which is essentially the Bupa version of the NHS 111 service. You also have access to a variety of hubs, health hubs, completely free of charge. So if you've been diagnosed with a condition or a family member has, you want to learn more about it, please feel free to use our website there. So bupa.co.uk/health-information. So a range of hubs based on various health conditions. For anyone that's having sort of symptoms or maybe going through the menopause, again, we have a very similar nurse-led line where our nurses have been trained to help people with this with a range of information. So you'll see the number on screen there. So again, anyone that wants to use this service completely free of charge via being part of the private medical scheme. And then anyone that's got any worried about other people, so potentially children or teenagers that you've got within the family might be going through some issues, you've got access to the family mental health line as well. So this is designed to help parents, carers, grandparents of a young person. It's designed to help you give that impartial advice, help you through how to maybe communicate or navigate issues that they're going through. Just again, an impartial nurse, specially trained nurse line given as part of the cover. And then the final couple of things from me before I hand over, the rewards platform. So bupa.co.uk/rewards. This is, again, completely free and accessible to everyone that's on the Bupa private medical scheme. It's essentially a range of discounts, the ever-changing discounts, exclusive offers just for being a Bupa member. So you can register there using your login that you've got for My Bupa. And then finally, a separate app, so a health and wellbeing focused app called Bupa Be Me, which you all get access to. So this can help you with a range of topics such as managing exercise, managing nutrition, and also help you set things such as goals linked to your health profile. So if you want to set yourself a certain steps challenge that might link to your wearables, so your smartwatch, those sorts of things, this again, completely free of charge to be used as part of your Bupa cover. Your login will be exactly the same as the My Bupa one that you create as well. So it's just there to make it that bit easier for you. So I'll hand back to you now, Roger, to see if there's any questions or whether we go on to Rob's session.
I think where my chairing, I've kind of let it go on a bit sort of, because there was some really good stuff there. I thought I knew, from listening to sort of Rob and my ECIS colleagues, I thought I knew quite a bit about it. there's loads of stuff I've learned there sort of thing, that I need to sort of digest sort of as well. So it's really good. If I might add though, because we're a bit tight on time, that we'll, I think, go on to Rob. We'll move on to Rob's sort of presentation, and then if we go a couple of minutes over at the end, which is very bad sharing, we'll look back and see what questions we've got, if that's okay, and hopefully our participants will bear with us if we go a few minutes over our sort of end time, sort of Sam says that. But thank you, Sam, and can I introduce sort of Rob.
Great, thanks, Sam. Thanks, Roger. Very happy to be here today to talk about the additional benefits that are offered as part of your JIB employment. And please, if there are any questions, do feel free to pop those in the chat or in the Q&A section. We'll get to those as soon as we can, as Roger says. I've got a few slides, a few more slides to share with you, just regarding those extra benefits. I'll just get that going for you now. Okay, so this is just about the additional benefits that are there for you as part of your JIB membership. And the JIB benefit package is provided by ECIS, the Electrical Contractors Insurance Service. My name is Rob Lowe, and I'm a Business Development Executive for ECIS. Quick agenda for us to run through: an intro to ECIS, who are we, what's the aim of the JIB benefit package in terms of financial security, occupational health, and a Q&A at the end, which I guess is going to be a broader Q&A for everything that we've talked about today. So firstly, who are ECIS? We are a small brokerage that's owned by ECA. We're regulated by the Financial Conduct Authority, and we have chartered status as well. We have a wealth of experience in the health and wellbeing market. ECIS have been looking after employee benefits for ECA member companies for around 40 years. So it's something that we've been involved in for a very long time, most of my life. And I've worked in private medical insurance for around 20 years. So it's something that I've been involved in for a long time too. As I say, we've been recognised for our commitment to service. We've been awarded chartered status by the Chartered Insurance Institute, which is something that we're very proud of. We operate the JIB benefit scheme, and we work with ECA, JIB and Select to provide private medical insurance to their members, and we're based in Sevenoaks in Kent. So what's the aim of the JIB benefit package? Financial support for loved ones should an employee pass away, financial support for employees if they can't work because they're ill, addresses issues before they start by focusing on maintaining workforce health, and to ensure employees are supported with a listening ear to turn to at any time of the day or night. So financial support for loved ones, there is a death in service benefit, and that's a one-off payment of £40,000 in the event that an employee passes away, and that is death by any cause. So whether that's at work or in other circumstances, that payment is available. There's no restriction on how that payment is used. So it can be used for funeral expenses, financial support for the family, really anything that the family or loved ones require a cash amount for in the event that that happens. That's what that payment is there for. There are some other scenarios in which that payment is increased. So death occurs while travelling to or from work, there's an additional benefit of £12,500. And if it's the direct result of an injury or disease sustained at work, an additional benefit of £55,000 is payable. Those are in addition to the £40,000 benefit for death by any cause. So if an employee should pass away while at work, then there's a potential combined benefit of £95,000, which hopefully should provide some financial comfort to the people that were relying on that individual should that happen. There's a sick pay benefit. So after 2 weeks absence due to sickness, employees benefit from sick pay of up to £210 a week. That ensures that employees can focus on getting better and getting back to work. Because of course, if you're unable to work, there is financial stress often involved with that. And that's in addition to statutory sick pay, payable for up to 50 weeks and then a year. And there's an additional payment following 8 weeks of absence as well. Accident cover. So workplace accidents, thankfully not that common. Employers work work hard to make sure that they are less common. There are benefits available for employees that are injured at work as part of the JIB scheme. There is a benefit for permanent and total disability, and that could be the loss of a limb, loss of use of a limb, loss of sight. There's a cash benefit available should that happen. There's a further benefit available if that injury or disease is due to an occupational accident. And if there's another serious illness or injury, then there is a discretionary payment of up to £25,000 that may be paid out in that instance, which of course we hope does not come to pass. That's really everything that I've got to present to you today. I've rushed through it a little bit because I know that time is a concern. I haven't touched on the EAP service because I think Sam's covered that off really well in his presentation. But for the Q&A portion, I'm going to hand back to Roger. If anybody does want to reach out to me regarding anything that I've discussed today, bearing in mind that we've gone through it quite quickly, please feel free to drop me an email. My details are there, or Roger can put you in touch with me if you need to talk. Thanks a lot.
Lovely, thanks, Rob. And thank you for bringing us back onto time, sort of as well, because that's very poor chairing, sort of from me. I see Sam did answer one of the questions already. We've got a question about occupational health assessments. Perhaps that's. Did you want to pick that one up, Rob, or did you want me to pick that one up?
I don't believe we do cover occupational health assessments at the moment. Can you just help me out with that one?
Yeah, no, that's fine. What the JIB offer is some money, £85 every 3 years towards a prescribed occupational health assessment. Now that's claimed back. That money's claimed back through, and this is a question I was going to pose to Rob actually, through the canopy system. I'm just wondering whether perhaps you could just outline what the canopy system sort of is.
Yeah, absolutely. So we operate an online portal called Canopy, where employers can view all of the details of the cover they're providing for their employees. You can access documents there and you can submit claims. Thanks for reminding me of the benefit that's claimable towards that. I was thinking more along the lines of a fully funded occupational health assessment when it's needed, but you're right, £85 every 3 years is the offer. So basically you would log into Canopy using your employer portal within that site and submit the claim there. There's a Q&A available in Canopy, FAQs, so that if you need any assistance, you can find it. Any problems you have submitting that claim, just reach out to us at ECIS and we'll assist you in any way you need.
Just, I suppose, a little follow-on from that. So, and this might sound kind of quite obvious. I'll have one. I've got one for you in a second, sort of Sam. But the canopy system and interaction with ECIS covers off all the elements that covers off most of the elements that you've spoken about, Rob, or either via the canopy system or direct with ECIS. Interactions with Bupa. I'm stating the obvious, but those claims and everything will go via a direct relationship between the individual and Bupa via an app, phone call, website.
That's exactly right.
Is that? I see Sam sort of like nodding, just so we're on the sort of same sort of page, sort of thing. I've got a quick one for sort of Sam on the digital access to a GP. Are there any restrictions on where you can access this from? I'm thinking I'm on holiday, I've got bitten by a mosquito or something potentially more sort of serious. Is it still accessible in that sort of case?
So as it stands, it's UK only, and that's because the GPs are only registered to operate and give advice within the UK. So I think it's just, it's for use when someone is actually within the United Kingdom from that perspective.
No, that makes sense. One of the questions that we had in. Just a couple other things. Someone's asking for the copy of the slides. Yeah, we'll be providing the slides afterwards. And are there any materials or information we can pass to our employees? But there is a really good sort of one pager, if I sort of call it that ECIS have developed. that we will also make available. It's available on the JIB website. When I send the slides out, I'll send a link to where you can download that sort of from on the JIB website. But it's a really good summary leaflet, really kind of high level, but it's really good to hand out to your operatives and just picks off the main things before they have to kind of perhaps then delve into a more sort of detail if they want to find out about anything sort of specific that isn't covered off there. Can't say. So I've got one here. Just I think we're coming to we've just gone a minute over, but I'll take this last one. Would there be additional financial help for someone who's had an operation and is not fit enough to return to work? I suspect, Rob, would that be possibly covered off under the sick pay if they've covered under? I don't know. I'll ask a question.
Yeah, the sick pay is the benefit that would be intended to cover that. We recognise that in many cases it's not going to replace someone's income, but that's the benefit that the scheme provides, and it's the most it can do. If someone's unable to return to work because they suffered an injury at work, then it may be that there's a larger financial benefit for that. But if they can't return to work due to illness, then as long as they're still employed and have access to the JIB benefit package, they'll continue to receive the sick pay.
Oh, okay. So just to be clear, they might have received treatment. I'm just putting a scenario. They might have received treatment via Bupa, for example, and sort of private medical, and then they're not fit enough to return to work. They can at whatever point, appropriate point, access the sick pay sort of element of the cover sort of as well to supplement sort of thing. I will call things to a close there. Sam, Rob, thank you very much though. Thanks a lot. And
thanks everyone.
Thanks everyone.
Bye bye.
Bye now.